Good morning, everyone. It's Dr. Charlotte Hodges, and you will have to forgive my videoing this morning. I'm out for my morning walk, and I completely forgot my selfie stick, and I was so proud of myself that I had bought a selfie stick, because it certainly makes holding this stupid camera a lot easier. But there you go. So please forgive all the bumping along. So let's get right to it. I've had several patients ask me here recently about why I do not perform robotic surgery. And so I thought that this was a great opportunity to discuss the pros and cons and the comparison between laparoscopic bariatric surgery to robotic surgery. And I will tell you, up until some recent studies, in my personal experience, there always seemed to be two camps. You're either in the laparoscopic camp or you're in the robotic camp. And clearly, because we're all surgeons, we all think we're right. And while we're not the Hatfields and McCoys, we all certainly have strong opinions on why we think our way to operate is superior to the other. And let me kind of just start from the beginning of my training. In my training, I did a ton of laparoscopic surgery, but I also did have the opportunity to learn how to use the Da Vinci robot. When the robot was coming out, it was touted for bariatrics as being able to offer better outcomes for our patients. And isn't that what we all want? We want to make sure that if we're going to be doing a new procedure or a new technique, we certainly want it to match what we're doing currently. But if I'm going to take the time to really perfect a new technique, I want to make sure that it's going to be something better, and that it's going to offer better outcomes, shorter operative times, whatever, for my patients. And there have been a number of different studies back and forth about which is oh my goodness. See, that is what happens when you don't have a selfie stick. OMG. So there have been a number of different, a number of different studies back and forth saying laparoscopic bariatric surgery is better, robotic surgery is better. And I will say as a disclaimer, I certainly think surgery in the pelvis is greatly helped with the robot. So if you're going to an OB-GYN or a urologist, I mean, robotics is the way to go. But is that really the way to go when you're performing a straightforward bariatric procedure? Now, in my very humble opinion, I don't see any great advantage of robotic surgery over laparoscopic surgery. I've done thousands of laparoscopic cases, and I just don't see, for myself personally, that my patients are going to have better outcomes than what I already have. All of my outcomes, they're lower than the national average, and this is especially for my revision patients and even for my duodenum switch patients. So I just don't see a big advantage of me trying to perfect a new technique. Now, what I'm always holding out for is if they could eventually show me how to do a single site sleeve. I've had a couple of them tell me, but I still end up with a great big incision for the port, and that kind of defeats the purpose. If you're going to do a single site surgery, you still want to have a small incision. But clearly that is still in the works. Unfortunately, since I got out of residency, they've been telling me that's in the works. But what does the research say? Does any of the research back up my own personal opinions and what I've seen clinically in my own practice? So like I said, there have been a number of different studies back and forth supporting laparoscopic surgery, and then on the other camp supporting robotic surgery. And then I thought it was kind of a game changer when I was doing my research, because there were two really large studies that were done using the MBSA-QIP database. And the MBSA-QIP database is the quality database that was created from all the patients that are undergoing bariatric surgery at these different centers of excellence. And at most of the facilities where I operate, they are part of the MBSA-QIP program. I'm also the bariatric director at one of these programs as well. And so using this database gives you a much larger pool of patients to draw from with a variety of different health problems, different BMIs. And so you can just have a much more robust research paper. And the larger your sample size, see, y'all are getting a statistics lesson right here. The larger your sample size, the more robust your research results will be, and the more applicable it will be to your patient population, because you're able to look at a really big pool of patients, and then you can now more safely apply it to the patients in your own practice. So in January of this year, there was a very large study. Over 63,000 patients were included, and they were looking at laparoscopic versus robotic sleeve in patients with a BMI over 50. And I thought that the results were very interesting. It showed that there was a significant difference between operative time. Operative time was much longer in patients undergoing robotic surgery with a sleeve and a higher BMI, and readmission rates and outcomes were worse in terms of complications after surgery, particularly intra-abdominal infection when the robot was used for surgery as opposed to laparoscopic. And one of the conclusions was also, should you even be doing the robot whenever you're performing a sleeve on a patient with a BMI over 50? Now, that was just one of the author's suggestions. And I know that there's going to be a ton of surgeons out there that use the robot and they have good outcomes. And I'm not saying that you do not have good outcomes. Please don't think I'm saying that at all. What I'm saying is I'm quoting the research that shows there was a really large study that did not show any improvement in care or outcomes for the patients when you used the robot over using traditional laparoscopic surgery. And then here in June, another very large study, and it included over 90,000 patients, and it was looking at the long-term efficacy, that means how well something works, between robotic sleeve and robotic bypass versus laparoscopic sleeve and bypass. And essentially what it showed was that there was no long-term difference in outcomes. There was no improvement in hospital stay or readmission stay. So there was no improvement in the efficacy. It was essentially, they didn't see any difference. Whenever they looked at this wide population, they weren't just looking at patients with a BMI over 50. So as a general rule, there really wasn't a difference between robot versus laparoscopic procedures in terms of outcomes. And so I feel like there you have it. Looking at that really large study, for me, it just kind of confirms that in the end, whether you undergo laparoscopic surgery or robotic surgery, you're going to have the best outcome whenever you have a surgeon that is really proficient at doing whatever surgery that it is that they do. So you want to go to a surgeon that has a high volume. You want to go to a surgeon that's going to a reputable facility, preferably if they can be part of the MBSA Quips Center of Excellence program. Because what the research shows is that there's not really a big difference between a robot and doing and having surgery laparoscopically. And for me, it almost seems to be surgeon preference. And that's what the research shows, that there's no great advantage of one over the other. I know that any one of y'all can go to Google Scholar and pull up a study that will show one way or the other. But this really big study that literally just came out in June, I think was very telling because it just encompassed so many patients. I mean, I don't know if there's been a study that's really compared the two procedures or the two techniques with such a large patient population as this one that just came out in June. And I think that that's why it makes it so robust. And it really just goes home to reinforce the fact that there's not one great advantage of one over the other. There's always going to be different particular cases, but it really, I believe, it comes down to surgeon preference. And and how well the surgeon's been trained on whichever technique it is that they're using. So I hope that this has kind of helped you guys. I think what this has done is it just reinforces, just do your homework whenever you're looking online and you're talking and interviewing with different surgeons. Whenever you're going to undergo your bariatric surgery, you certainly want to make sure you have a good rapport with your surgeon and also with their office, because you guys know there's a bunch of hoops that you need to jump through. And then also ask your surgeon, how many cases have you done? What facilities do you perform your cases? Where are they? Are they centers of excellence? Why do you like one over another? Because what the data now shows is that there's not a significant improvement of one way to perform the surgery over another, and it's really surgeon preference. So hope that this has been really helpful. Please share this with your friends, especially if you're contemplating weight loss surgery and you've had one person in your ear buzzing about, oh, you should only do it laparoscopically. And you've had somebody else, you've seen these wonderful ads that say, hey, you need to use the latest and greatest technique. It's called the robot. And then you can say, yep. And there was a study that just came out that said that's not necessarily any better. So I'm just going to go to the surgeon that knows what they're doing and that does whatever procedure that they do a lot. So give me a thumbs up. Don't forget to share this, and don't forget to subscribe. Take care.